A lockdown could be imminent for Indonesia as it battles its worst wave of coronavirus infections. President Joko Widodo is meeting health officials to consider new restrictions that could be enforced as early as tomorrow. The Red Cross has warned that the situation is on the edge of a catastrophe.
Hospitals across Indonesia, including the hard-hit capital Jakarta, are on the brink of collapse. Bed occupancy rates have exceeded 90%. Oxygen supplies are also running low. The more infectious Delta variant is ravaging Indonesia's health system and fueling the country's soaring infections.
Rumah sakit, tapi rumah sakit nggak ada tempat kan, penuh, kasihan. Dia stroke, dia kan harus pakai oksigen. Oksigen habis di rumah sakit. Makanya dibawa pulang, kita beli oksigen sendiri di rumah. Jadi dirawat di rumah.
Indonesia has reported record daily COVID-19 infections of more than 20,000 in recent days. The spike comes after millions traveled at the end of the Muslim fasting month of Ramadan in May. One humanitarian organization warns that Indonesia is on the edge of a COVID-19 catastrophe.
Inside of Jakarta, over half of all of those people that are tested are positive. When you get outside of Jakarta, you're finding that over 90% of those that are tested are positive. We're trying to, do whatever we can to stop. And that happens through vaccination. That happens through keeping people from congregating. That happens through making sure that people get the same information.
Indonesia is banking on mass vaccinations to curb the virus. It aims to inoculate over 180 million of its 270 million people by early next year. But only about 7% of the population has been fully vaccinated so far.
Saiful Bahri Ismail joins us live now for more. Saiful, lots of anticipation that an announcement of a lockdown could come tonight.
Well, Dawn, the Indonesian government has not made any announcements yet on the possible tighter restrictions. However, there have been news reports saying authorities may impose tighter restrictions to curb the spread of COVID-19 in Indonesia. This is reportedly called the emergency public activity restrictions. Now, the new measures may require all workers in the non-essential sector to work from home and no dining in at restaurants. Now, this is similar to the large-scale social restrictions or PSBB that we saw imposed by the government in April last year. Now, currently, 25% of company employees are allowed to work from the office, and restaurant dine-ins are limited to 25% of capacity. Now, the Indonesian government has been under pressure to introduce tighter measures as daily COVID-19 cases continue to surge. Now, just over the last 24 hours, more than 20,400 fresh COVID-19 cases have been reported and 463 deaths. Last month, when COVID-19 cases started to increase significantly, President Joko Widodo insisted that the current micro-scale public activity restrictions, or locally known as PPKM micro, is still the best option available. Now, Mr. Widodo said the government had taken into account the country's economic, social and political conditions, as well as the experiences of other countries in determining that the PPKM micro would be able to limit public mobility while preventing a total economic shutdown. Health experts said the PPKM micro is no longer effective. The PPKM micro, which is implemented over a period of 2 weeks, has been in place since February this year, and authorities have kept extending the restrictions again and again at the end of the 2 weeks. The COVID-19 numbers have not improved significantly, so we may see a possible shift in strategy soon.
And Saiful, are officials even confident that they can bring, the current outbreak under control?
Well, Dawn, a tighter lockdown alone may not be enough. Health experts said a lockdown has to be complemented by more aggressive vaccination rollout so that more people can get protection and the country can achieve its herd immunity status as quickly as possible. Now, so far, more than 28 million people have received at least one dose of the COVID-19 vaccine. Now, this is only about 15% out of the 181 million people that need to be vaccinated to achieve a herd immunity. Now, on Monday, President Joko Widodo announced that COVID-19 vaccination for the 12 to 17 age group could soon commence after the Food and Drug Monitoring Agency permitted the use of the Sinovac vaccine for the group. Mr. Widodo has set a target to scale up COVID-19 vaccinations to cover 2 million people per day by August this year. Now, Indonesia managed to administer 1.3 million vaccine doses on Saturday, exceeding the earlier target of 1 million doses per day that was set starting July. Now, besides lockdowns and vaccinations, the other critical component in the equation is public discipline. The government may sound like a broken record, repeating the same message over and over again to the public about the need to wear their masks, to avoid crowded places and maintain strict COVID-19 health protocols. But this is something everyone has to follow and do, especially with the more transmissible COVID-19 variants wreaking havoc in the country.
Saiful, thank you for that update. Saiful Bahri Ismail there in Jakarta.